Everyone, I just wanted to make a quick video about the HLA subtypes and their associated diseases. This is a kind of tedious thing to memorize for step one, but I hopefully have some quick little shortcuts to help you all out. The first one I think of just using kind of nerd speak, A3 being an A and an E, and that helps me remember hemochromatosis. The next one is B27 and its association pair spectrum of diseases, and I think of buying 27 pairs of pants. And so this reminds me of psoriasis, ankylosing spondylitis, inflammatory bowel disease, and Reiter syndrome. DQ2, DQ8, this makes me think of going to Dairy Queen, DQ from 2 to 8 p.m. And if we were to do this, we would be suffering from some diet-based GI disturbances, as you could imagine. And this makes me think of celiac disease. DR2, I think of 2 by 2 by 2, which is 2 words, and these are going to come sequentially in alphabetical order. Going from G to H, and then from L to M. So G, we think of good pastures, and good pastures, you can also, thing I used to remember good pasture is also thinking of the 2 as good pasture. The H in the second sequence of the 2 letters is hay fever, and that's another 2-worder. Next we move on to L, and we think of SLE, or just to make it fit this mnemonic, lupus erythematosus. And next, finally, we have multiple sclerosis, which is kind of a two phrasing, and it's going to start with M, the second letter LM. DR3, we think of R3. This is another time using, the nerd speak, leet speak, and GR3Y reminds me of gray. This reminds me of Graves' disease. We also have to remember with DR3 and then our next one, which is DR4, that these both have an association with diabetes mellitus type 1. And I remember these by thinking about 3 and 4 being 30s and 40s, and that could be the age 30s or 40s, or BMI 30s or 40s of when someone you might expect to get diabetes. Of course, we know that they wouldn't actually be getting these types of diabetes. Type 1, of course, is childhood onset or juvenile diabetes, but it's just a way that I remember it. Finally, for 4, I like to think of RAV4, and that RA reminds me of rheumatoid arthritis. Finally, this one is a little bit of a stretch, but I assure you that after you use these ridiculous mnemonics, even if it seems stupid, the stupider it is will probably make it easier to remember. So for DR5, I think of what has 5 sides, and I think of kind of a home in like this pentagon-y shape. So what is alternative medicine? Some of that is called homeopathy. And so I think of homeopath, and that path helps me remember pernicious anemia for the PA, and then with a little bit of creativity, you move around thyroiditis and Hashimoto's to remember Hashimoto's thyroiditis. Hopefully watch this video once or twice, you'll have them all remembered, and then they will be easy to remember, and you'll do great on step 1. Other videos that you'd like someone to make a video for? If you have any ideas, anything on step 1 material that's giving you a lot of difficulty, just write a comment and I'll try to get to them when med school allows.